The control of overweight and of obesity and of clinical conditions such as the metabolic syndrome and diabetes is one of the main targets we need to achieve if we want to reduce the incidence of the degenerative disorders typical of our society and to improve the level of health of the population. Experts agree upon the fact that a proper nutrition and a good level of physical activity can help. But some debate is on nutrition still. What we still do not know exactly is if it is more important to reduce the intake of fats or of sugar to improve the level of health of the population. We want to take advantage of the presence in Italy of Professor Sievenpiper, an expert of this area from a group of David Jenkins in Canada, to ask his opinion about this topic. Professor Sievenpiper, what do you think of the fats versus sugar debate? Do you think we have enough evidence to say that sugars rather than fats are the main cause of the epidemics of overweight and obesity in our societies?
Yeah, I think it's a very good question because I think we have to have a sense of history in that this debate very much was dominated by the fat story for a very long time, and now it's switched to sugar, and I think we have to appreciate that history. I think the debate shares a lot of similarities with the fat story in that the data that's been used to implicate sugars is very similar to the data that was used to implicate fats. It comes from what we call ecological studies. It's just population level data where we look at associations both geographically and temporally over time and between an exposure, which in this case is sugar or fat, and an outcome. The issue with these data is that they're quite limited in that our ability to draw generalizations is limited because of our inability really to control for a lot of other factors which change over the same time. So a lot of this data was used to implicate fat, and we're seeing a lot of this data being used to implicate sugars. We also see a lot of data from animal studies where there is an issue whether we really can translate from animals to humans. I think we need to really put these data aside, as we have done recently for fat, and I think that's partly why fat, in a way, has been exonerated, if you like. It's no longer considered the bad guy. I think we need to do the same thing for sugar, and we do that, and we look at the highest level of evidence that we have from well-done, well-conducted prospective cohort studies. These are observational studies where we have a reasonably good measurement of the exposure, in this case to sugars, and good ascertainment of the outcomes. And beyond that, we have the ability really to adjust for many factors which also might contribute to disease. And we look at those, and we also look then at randomized controlled trials, which give us the best protection against bias. What we find is that we don't see that sugar is the sole bad guy, if you like, that is solely responsible for the chronic disease burden and obesity that we have. We see that it may be one contributor, as are fats and other parts of dietary pattern, but really only insofar as it's contributing excess calories. So when we look very carefully, for example, at sugar in randomized trials, we see that when you replace sugars with other carbohydrates, for example, refined starches, glucose, other non-fructose containing sugar carbohydrates, we see that the sugars don't behave any differently than other carbohydrates. And I think that's true even where we see that where fat has been a comparator. So I think the issue really is one of overconsumption, and one needs to really, I think, stress that it's about overconsumption. The other issue too is one of the context in which we eat it. Now, often we don't eat sugars alone, and if we simply reduce it, we end up increasing something else. So we have to be careful, I think, in thinking about this in the context of a dietary pattern and a lifestyle pattern. So it's going to be, if you're just going to replace the sugar with starch or another source of carbohydrate, and we're not going to change the calories, then likely the outcome won't be the same. Whereas if we think about diets more as a whole, and we think about healthy eating dietary patterns such as a Mediterranean diet, or a low glycemic index dietary pattern, or a DASH dietary pattern, we see here we actually tell people to eat more fruits and vegetables, more nuts, more legumes like pulses, beans, peas, chickpeas, and lentils. That necessarily you can reduce some of the sugar and the fat and the salt, some of the things that have been implicated, and you get better outcomes. So I think it's better probably to dwell on positive messages about the whole dietary pattern, where I think fats have a place and sugars have a place, and really where it's about moderation and emphasis of those whole foods where we know we have some advantages and benefits.
And what do you think of the recent WHO proposal to reduce the limit of intake of sugar to 5% of total energy?
Okay, first I would start by saying that the WHO proposal to limit sugars, and in particular free sugars, to less than 10% as a recommendation, and a conditional recommendation less than 5%, is derived from two systematic reviews and meta-analyses that were done, one in relation to body weight and one in relation to dental caries. The new conditional recommendation, it's not a full recommendation and it's still in the proposal stage to limit it to less than 5%, is based exclusively on dental caries. So it has nothing to do with weight or other health outcomes. So I think it needs to be qualified and needs to be seen in that respect, that it really relates to dental caries. I think that's the first thing, is that it applies to dental caries. The second thing is that particular recommendation, based on the systematic review meta-analysis that was commissioned by the WHO on dental caries, was based on very low quality evidence, and that was the conclusion of the people that conducted the systematic review meta-analysis, not my own conclusion, although I agree with it. So I think that is the reason that they made it a conditional recommendation, and I think it needs to be regarded with some caution in how it's interpreted and how it's applied. I think really the two systematic reviews meta-analyses they did to update their recommendations from 2003, one on body weight and one on dental caries, really in terms of body weight only reinforce the notion that sugars as a source of excess calories are the issue. When they did the body weight analysis, what they showed was when you match feed sugars for other sources of carbohydrate, so you match the calories, that there was no more weight gain with sugars than there was another source of calories. It was only where it provided excess calories. The conclusion of that systematic review by a group in New Zealand, Lise Teemering and Jim Mann, was that the sugars appear to be contributing to weight gain only insofar as they're contributing excess calories. So I think that if you want to interpret those recommendations in terms of population level dietary advice as it relates to body weight and those things that come from body weight as opposed to dental caries, really it has to be qualified in terms of calories. It's where sugars are providing excess calories. That being said, I think it's certainly where possible added sugars. Often added sugars in the diet when they're consumed tend to be in sources which might be nutrient poor, not have a lot of nutrients, and are, like a lot of highly palatable foods, such as those that have fat as well as sugar, may be overconsumed. So I think that it's sensible, that's a sensible place to start to reduce sugars, but I think we have to be very careful in interpreting those recommendations based on the evidence.
Well, one of the critical issues of sucrose, according to some authors, is the presence in its molecule of fructose. You have extensively studied the relationship between fructose intake and human health. What do you think about this position?
The fructose question is an important question. The sugar debate really hinges on fructose having a unique biochemistry, a unique metabolism, a unique set of endocrine responses, which really allow it then to have all of these negative and adverse effects. That's the hypothesis as it's been presented. So we really wanted to look at this question of fructose to say, is there something special or particular about fructose, about the way it's metabolized, the way it's in terms of, does that biochemistry, that difference in metabolism, that difference in endocrine response actually translate into meaningful differences in terms of clinical effects on body weight, on blood pressure, on your blood cholesterol and blood lipids, on fatty liver, and questions such as that. When we looked at that, we looked at it carefully, and I think, again, like with the other question, I will answer by saying I think we need higher level of evidence, so we need to move away from ecological studies and animal studies. So when we apply we look at the highest level of evidence from controlled feeding trials, which gives us the best protection against bias, and we look at the totality of that evidence by doing a systematic review and meta-analysis, so apply the best tools that we have, which is what we did. What we find is that fructose, when it's replaced with other forms of carbohydrate, keeping calories equal, so an isocaloric exchange, is no worse than other forms of carbohydrate. And there may even be advantages for blood sugar control, something that was proposed in the 1970s and 80s, that it might be an important alternative sweetener in people with diabetes, for example, and blood pressure control. But overall, no worse when it matches for calories. Fructose is only an issue when we see comparisons where fructose provides excess calories, it's added to a diet, providing excess calories compared to the diet without those excess calories. So where you have that imbalance of calories, where fructose is providing excess calories, then you do see the weight gain. You do see the increase in blood cholesterol and blood lipids. You do see the increase in blood sugar and insulin. You do see the increase in fatty liver and in uric acid, but only where it's providing the excess calories. And we look at comparisons where we overfeed fructose versus overfeeding of other carbohydrate, we see that it's no different than what you would get with overfeeding of other carbohydrates. So our conclusion really is, in the absence of seeing an effect of fructose beyond its calories, only seeing it really where it provides excess calories, not seeing where we match for calories, the effects that we see with fructose, these adverse effects which have been attributed to it, really are owing to the excess calories. So I think, like with other sources of highly palatable calories, we have to be careful not to overconsume. But if we're consuming a moderate quantity, we're not exceeding our caloric requirements, we're eating a nutrient-balanced diet, I think there's no reason to be concerned about fructose. And potentially, there may even be some advantages. The other thing I would add is that to this is that people have taken the fructose data to suggest that we shouldn't be consuming fruit as a source of fructose. And I think that this is a particularly dangerous message, because if anything is uncontroversial in nutrition, really, that's the fruits and vegetables are not only safe, not without harm, but also beneficial in terms of meeting one's dietary requirements for nutrients and also having health benefits. And when we look at this data, I think that that reinforces that we don't need to be worried about fructose. And in particular, when we look at smaller amounts, those advantages that I talked about in terms of blood sugar control and blood pressure might be there, might explain some of the advantages we see with fruit.
And which is the safe limit of intake of fructose in your experience?
So a safe intake of fructose, I think, depends. I think it depends on the individual. I think we have to differentiate between population levels of intake and individual levels of intake. I think where fructose provides excess calories, or sugars provide excess calories, I think there's an issue. So if we look at the individual's diet, if we find that sugars are providing a lot of excess calories, then they need to be reduced. And I think that doesn't matter whether it's a higher or lower amount, it's the issue is it's the excess calories. On a population level, I think the best data we have really to look at, and I'm going to start really talking about sugars, and then we'll talk about fructose, is looking at nutrient dilution, micronutrient dilution data. So the Institute of Medicine, in their dietary reference intakes, looked at the data for sugars, added sugars, and determined that safe intake is probably up to about 25% of calories. Beyond that, there is the potential for micronutrient dilution. So we see micronutrients like calcium, for example, lower. I think that that's probably the best data we have in terms of setting an upper limit for sugars. For fructose, because we don't tend to consume fructose alone, we consume it as part of sugars or in fruit, I think it's a bit harder to know where that safe limit is. If we look at our series of systematic reviews and meta-analyses in humans, looking at data from controlled feeding trials, we find is that really it's only where fructose provides excess calories there appears to be an issue. So calories are the issue. Where we do see under matched calorie feeding a potential for adverse effects maybe on lipids is probably around 100 grams per day. It's hard to know how real that is, but I would say that could be used potentially as a level, so not more than 100 grams per day. When we look at data in people with diabetes, we find that there may be a triglyceride effect, for example, at greater than 60 grams. So somewhere between over 60 to 100 grams, I think people need to start being careful and looking at their diet carefully. But really, the best data we have from our systematic reviews and analyses suggests that it's really only where it's providing the excess calories that we see the signal. And for total sugars, I think added sugars, it relates to micronutrient dilution. So I think eating less than 25% of calories as added sugars is a safe limit.